Good evening, class. This is Dan Anthony, and I am your first teacher for this evening. Me and my fellow teachers are assigned to discuss the Module 13, Learners with Mobility Impairment, Psychological Disabilities, Seizure Disorders, and Traumatic Brain Injuries. As your first teacher for this evening, I am responsible to discuss to you class the teaching strategies, mobility impairments. Okay, let's start. First, let us know what mobility impairments are. Mobility impairments refer to a broad range of disabilities which limit functions of moving in any of the limbs or in fine motor ability. So, sa madaling salita, ito ay mga individual na nahihirapan sa paglakad, pagkilos o pagmanipula ng isang bagay. This is because they have problems with their lower body parts, which have accumulated either dahil na-aksidente sila before and they were injured, or because it was inborn. Since this is a recorded video, I assume that you will ask me what is fine motor ability. When we talk about fine motor ability, we are talking about hand precision, dexterity, and coordination. These are the abilities that allow us to manipulate materials such as pincers, containers, fasteners, and small objects with our hands. Okay, some of the common disabilities that are considered as mobility impairments include arthritis, muscular dystrophy, multiple sclerosis, spinal cord injuries, cerebral palsy, and amputation. Sir, how about people that have asthma? Well, yes, it can be considered as mobility impairments. Why? People with asthma can move, but not as freely as normal people because it may trigger their asthma and thus restrict their movements. Furthermore, respiratory disorders, pulmonary disease, and cardiac disease are not visible but can impair our mobility. So that is why it could be considered as mobility impairment. Students who have mobility issues rely on assistive devices like wheelchairs, walkers, canes, crutches, and artificial limbs to move around. Mobility impairment may cause difficulty entering classrooms, sitting for long periods of time, manipulating pencils, writing, and many more. Sila yung mga estudyante na halos araw-araw nahihirapan sa pagpasok sa paaralan dahil sa kanilang kalagayan and hindi madali sa kanila na magmanipula ng mga bagay-bagay. Let's move on to some of the instructional strategies to help students with mobility impairments depending on the student's individual needs. Instructional strategies to help students with mobility impairments are the following. Number one, refer any physical barriers to classroom accessibility to the Office of Service for individuals with disability immediately. For example, you have a new student who is using a wheelchair and you notice that there is no appropriate armrest or table for him or for her. As a result, you must immediately notify the office in order for them to address this barrier and provide accessibility. Another example, you have a student who has respiratory issues such as asthma, and there is no asthma emergency kit in your classroom. As a result, you must notify the office as soon as possible so that they can provide the necessary emergency kit. Number two, permit student to use tape recorders or note takers to adequately record course materials when appropriate. Why? In order for them to recall the discussion, especially if the student has problem in writing and listening. Number three, team the student with a laboratory partner or assistant. Number four, allow in-class written assignment to be completed out of the class when appropriate. So we must be considerate. Number five, extend deadlines or employ incomplete grades when appropriate. Yes. Number 6, allow extended time on tasks as recommended on support plans. Student may need to use a scribe or write answer for themselves. Why? If a student is slow in writing due to an impairment or disability, you must, of course, give them more time to complete the exam. Number 7, student who cannot write answer for themselves may need to take oral or tape exams. Number 8, make occasional allowance for late arrivals to class if students are using devices such as crutches, wheelchairs, canes, or walkers. And number 9, rearrange desks to allow extra space needed for wheelchairs, walkers, canes, and crutches. Why? To provide a comfortable and accessible environment for students. These students require space not only for their assistive equipment but also for their own safety. For example, again, students with asthma, they require space where they can freely take in air and are free of dust. We cannot place an asthmatic student in a crowded, dusty environment. It will undoubtedly amplify the child's asthma. Okay, that is my part of discussion and that is my contribution for this discussion. May I call on my fellow teacher to take the stage? Thank you.
Hello everyone, I am teacher Jenny and I will be discussing about the teaching strategies for psychological disabilities. Some individuals experience a severe disturbance in thinking, feeling, relating, and behavior. Many different psychological disorders can have a cognitive, emotional, and or social impact on a student's ability to function in an academic environment. The symptoms and associated impairment may be either chronic or episodic. The possible characteristics and symptoms of these cases are chronic absences, consistently late assignments, extreme highs or lows in moods, anxieties, problems on concentrating, problems on remembering, marked personality change, confused or disorganized thinking, thinking or talking about suicide, and denial of obvious problems. The American Psychiatric Association defines a psychological disability as any persistent psychological or psychiatric disorder or emotional or mental illness resulting in impairment of education, social, or vocational functioning as reported by a mental health professional based on a diagnosis from the Diagnosis and Statistical Manual of Mental Disorders. Examples of psychological disabilities include manic depression, bipolar disorder, depression, schizophrenia, personality disorder, post-traumatic stress disorder, anxiety disorder, delusional disorder, and eating disorder. These psychological disabilities can create barriers to education in different ways. First, stigmas associated with psychological disabilities prevent many students from self-identifying and subsequently receiving the help that they may need. Additionally, individuals with psychological disabilities often take medication that may provide or that may produce side effects such as restlessness, drowsiness, fatigue, excessive thirst, blurred visions, and hand tremors. Now let's learn about the following list of strategies that can be used with students who have psychological disabilities. Instructional strategies to help students with psychological disabilities are the following. Allow students who have difficulty concentrating to tape lectures or use note taker. Provide alternative testing, extended time, and or distraction-free room for students who are easily distracted by the noise or activity. Give cues to the task at hand and or break down the task into small steps when students experience difficulty focusing on task, and offer breaks to students who become fatigued. We can also provide the following for students who have difficulty managing time and deadlines, like planning projects by breaking them into small manageable parts, clearly detailed syllabi, advance notice for tests and quizzes, addressing inappropriate classroom behavior with the student in private, delineating if necessary the limits of acceptable behavior, permit and also permit late withdrawals or incompletes in the event of disability related excessive absences. As future educators and as teachers, we should know how to create a supportive environment for our students. When a student discloses a psychological disability and requests assistance in arranging for accommodations, make every effort to be supportive and welcoming. Try to avoid comments that inadvertently suggest that the student could do something to better prevent or control these symptoms. The students with psychological disabilities are sensitive and fragile, so we need to be careful with our words and actions that could trigger these psychological disorders. And also, don't forget to provide regular feedback on their academic work to make their day better. And also remember that you don't need a specialized knowledge to help a student through difficult times or rough times. Sometimes a warm presence is enough for them to feel safe. And also don't forget to be kind and to be patient with them. And that concludes my discussion about the teaching strategies psychological disabilities. The next presenter will be Teacher Jess, and she will be going to discuss the teaching strategies seizure disorders.
Thank you, Teacher Jean. This time I will be discussing teaching strategies seizure disorder and its procedures. Teaching strategies seizure disorder. Seizures result from imbalance in the electrical activity of the brain. Our brain is made up of billions of neurons that communicate with one another by sending and receiving electrical impulses. So, a seizure happens when there is an abrupt, abnormal electrical activity that briefly disrupts normal brain function. Behavior, sensation, movement, or consciousness changes may result from this additional activity. Causes of seizures remain uncertain. There is an evidence that brain injuries and tumors may give rise to seizures. There are two types of seizures: focal or partial seizure and generalized seizure. Focal or partial seizure happen in just one part of the brain, while generalized seizure seem to occur all over the brain. Symptoms usually depend on the type of seizures and can include temporary confusion, staring spells, convulsions, and loss of consciousness. There are three distinct types of seizures, namely petit mal, grand mal seizures, and psychomotor seizures. Petit mal means little seizure, characterized by eye blinking or staring. These last for a few seconds. They might be even unnoticeable. However, they do cause a temporary loss of consciousness which can be dangerous. Number 2, grand mal seizures, characterized by generalized contractions of muscles, twitching, and limb jerking. Grand mal seizures are those seizures that a person falls to the ground because they lose body control caused by a sudden involuntary twitching or jerking of muscles. Mura bitaw siya og kanang naggahi nga muscles mao dili gid nila makontrol. That's why they will fall on the ground. These seizures arise from the whole brain lights up the electricity all at once. So, mao ni siya ang generalized type sa seizure kay nahitabo man siya sa tibuok parts sa brain. Number 3, psychomotor seizures range from mild to severe. and may include staring, mental confusion, uncoordinated and random movement, incoherent speech and behavior outbursts, followed by immediate recovery. Psychomotor seizures is different from grand mal seizure since psychomotor only occurs in one area of the brain, which is the partial or focal type of seizure. And there are two different kinds of partial seizure. There's simple and complex. Simple could just be a feeling or sensation, or it could be very slight jerking. So simple type of partial seizure could still communicate while it was happening and know if something's funny. While in complex, they have some impairments. They may appear zoned out, look drunk, and spacey. These are individuals who may be moving their hands in odd ways while mumbling. So, kani sila, morbitog na sila gibuhaton pero wala silang huna-huna kaya ilang permin kabalik-balik kaon permi ilang gahimuon. For example, ang isa ka individual nagsige nagpanilhig niya diara sa isa ka space niya sige na nagbalik-balik kaon. So, inana ang psychomotor. So, therefore, unlike a generalized grand mal seizure which causes jerking and twitching of the body, ang psychomotor dili ana. But pwede sila mapareha sa grand mal pero dili permin ana sa psychomotor nga case kay kakahitabo raman siya sa isa ka part sa brain dili pareha sa grand mal nga sa tanan brain kakahitabo. So, procedures to follow if a seizure occurs in the classroom. Keep calm. Ease the person to the floor and open the shirt. You cannot stop the seizure. Let it run its course and do not try to revive the person. Remove hard or sharp objects which may injure the person, but do not restrain the person in any way. Do not force anything between the person's teeth. Turn the person's head on side for release of saliva. Place something soft under the head. Make sure that breathing is unobstructed, but do not be concerned if breathing is irregular. When the person regains consciousness, reorient him or her to surroundings and allow him or her to rest if desired. If the seizures last beyond a few minutes, or if the person seems to pass from one seizure to another without regaining consciousness, dial 911 and contact campus police to inform them of the situation. This rarely happens, but when it does, it should be treated immediately. Frequently, those who experience a grand mal seizure frequently lose control of their body functions. To avoid embarrassment, students should be covered with blanket or sheet. Note takers may be needed for students who experience petit mal seizures, as they may blank out for a brief time and continuity will be lost in a class. So, if a seizure occurs in my classroom, what should I do? As his or her teacher, I will follow the given procedure if a seizure occurs in the classroom. The first thing I should do is protect her or him from possible hazards such as chairs, tables, objects. Help and guide him or her on the floor and protect the head with a pillow, a sweater, or something else that's soft and will protect his or her head. I will stay calm, track the duration of the seizure, and remove classmate from the classroom. If the seizure lasts longer 2 minutes, it is an emergency. And if it's the first time a student has ever had a seizure, I will immediately call the office nurse, inform the staff if there's any, or call 911 directly and notify the parents or guardians. Following the seizure, I will turn him or her on her side, so ipatakilidayin siya, and remain with him or her until full awareness of his or her surroundings is restored, as well as provide emotional support. So, the same with psychomotor, but since they don't lose body control, since they just zone out or unconscious, I will just stay by his or her side, move dangerous objects out of reach, gently guide them away from potential danger without restraining or interfering too much with them. And once the seizure ends, I stay with him or her, assure him I assure him or her that he or she is okay, and I'll wait patiently until they have fully recovered. So I've learned that as a teacher, we must really know our students. We must be connected to them in order to know how to approach them. We must be prepared for what is possible so that we can be ready and have sufficient knowledge for their good and their safety. So, here is Teacher Jones to continue the last part of our discussion.
Good evening, everyone. I am Jemeline Gracie Tamarion, and I am one of your virtual teacher for tonight. I'm going to discuss teaching strategies traumatic brain injuries. So let's start. So before anything else, let's define what is traumatic brain injury. A traumatic brain injury is a form of acquired brain injury occurs when a sudden trauma causes damage to the brain. Traumatic brain injury can result when the head suddenly and violently hits an object or when an object forces the skull and enters brain tissue. A brain injury can result from two types of trauma. First is external events, such as closed head trauma or an object penetrating the brain. This happens when an object enters the skull and harms the brain. It can hurt a small or large part of the brain that will cause traumatic brain injury. Second is internal events, such as cerebral vascular accidents, tumors, ingestions of toxic substances, hypoxia, or infections of the brain. These internal events can cause also a traumatic brain injuries of the individuals. Students with traumatic brain injuries are becoming increasingly more prevalent. Therefore, it is really important for us to be knowledgeable or to be aware of the causes and the symptoms of traumatic brain injuries. So speaking of the symptoms of traumatic brain injuries, students exhibit one or more of the following symptoms. First is short-term memory problems. When they can easily forget the things that happened to them recently, such as an event, like just for example in the class. If you have one of the students na dali na kayo siya makalimot sa mga gi-discussed, so the possibility na siya traumatic brain injuries. Next is serious attention deficits, having a short attention span and being easily distracted. So, these symptoms is na siya similarity sa short-term memory problems na because in these symptoms, a person can be forgetful as well. And it turned out that they can't focus or stick to the tasks that are tedious or time-consuming. Next is behavior problems like frequent tantrums and outbursts, having difficulty in handling frustrations. So in this symptom, like they can't control their emotions, di nila kaya na kontrolon ilahang kaugalingon, labi na if masuko sila, ug naa sila mga gusto na dili nila makuha something inana. So if happens na maka-encounter mo ginana soon, so na possibility na kana siya nga bata is na ay traumatic brain injuries. So next, problem of judgments and serious anxiety attacks. When we see anxiety attacks, it is when a person is feeling worry and fear, or having a panic attacks that are sudden episodes of intense fear that triggers severe physical reactions when there is no real danger or apparent cause. So, mga po sila mga importante na bantayan, especially when we become a teachers, for us to be aware if naabate mga estudyante nga naay traumatic brain injuries. So now, why do we have to learn about this? Why do we have to know the symptoms of the traumatic brain injuries? So it is simply because it will help us to identify or to determine if the students are having a traumatic brain injuries. So, if isa sa inyo is mag-wonder na, ma'am, kami ma'am, mga English major man mi ma'am, kailangan pa dito magtuon mi ginani ma'am. So, class, of course, yes, you have to know and to understand because dili siya ibig sabihin nga Secondary inyong tudluan is dili na mo maka-encounter og students na naay traumatic brain injuries. So, di ba, it is really important for you because mga future educator mo and ipuhon-puhon, manotice din yun na naay traumatic brain injuries ang inyong one of the students, din kailangan ninyo mag-adjust and i-consider to siya nga students. What I mean is that you can use or you have to apply some strategies na makatabang sa estudyante na naay traumatic brain injuries. So that's the point why we need to understand and to know the symptoms class. Because if wata kabalo sa mga sintomas, sige, butang na sa sitwasyon, wata kabalo na naday traumatic brain injuries, wata kabalo na nag-exist day na. So, if someday na makatudlo na mo, naday mo estudyante na ay traumatic brain injuries. So, wala mo kabalo unsa dapat buhaton o mo kabalo unsay dapat i-apply sa iyaha na deserve niya para makatuon siya, diba? So, it would be unfair. So, it's better to be ready or to be prepared kaysa soon or someday wala mo kabalo sa inyong buhaton if maka-encounter na mo ana.
Okay, let's proceed to the strategies that can be used with students who have traumatic brain injuries. Changes in symptoms and conditions can occur at any time. This may require changes in accommodations as well as in education programs. The first strategies is to demonstrate new tasks and provide examples and other graphic to illustrate ideas and concepts because in that way it would be easier for the students to understand the topic and as well as the task given. Next strategies is to state instructions clearly. So this is one of the most important strategies now because as we can observe, if the instructions given are not clear, then it's not helpful for the students who have traumatic brain injuries. That is why every time we make instructions, we have to make sure that it is clear enough and go over each step so that the students can understand our instructions. Next is paraphrased informations to help with recall. The students can recall the informations when the teachers paraphrased it. So from the word paraphrased, it means that you have to rewrite the informations in your own words. And when you paraphrase the information, you have to focus the key points or the main points so that the students can understand the discussions well and they can easily recall the information. Next strategies is to review and summarize often. So you know what class, these strategies is very helpful to avoid the students for being forgetful about the discussions and in processing the information. Reviewing and summarizing the discussions before and after the class will help them na dili dayon nila malintan ang ilahang mga na-learn. And it will help them to recall the informations. Next is repeat all key points. Repeating the key points will help the students to understand the informations that you want them to remember. It will help the students who have traumatic brain injuries to avoid any confusion and mag-stick sila sa kung saan dapat nila matunan. Because the more you repeat your key ideas or key points, the more they keep it in their mind.
Provide ample time for task completions. So we should always remember that students with traumatic brain injuries are having difficulty in understanding the given task and processing the information right away. Therefore, as a teacher, you really have to provide extra time or ample of time for them to finish the task. Next is encourage the use of schedules, checklists, and notebooks to assist in organizing daily informations. So yes, as a teachers, you should encourage your students to use schedules, checklists, and notebooks in order for them to be guided in their daily activities. It will also help them in organizing their daily informations para maiwasan na makalimtan nila ilang mga importante nga dapat buhaton sa school. Next, break assignment into smaller parts. Break complex tasks down into steps. These strategies will help the students to comply with assignments with less hassle and it's manageable for them to complete. Diba, as a teachers, we really have to consider the efficiency level of our learners. That is why we make sure that ang atong mga activities, assignment, and tasks na ihatag is manageable lang para sa ila and makaya nila nga i-complete ang task and maka-learn sila at the same time. So, next is be prepared for reduced stamina and increased fatigue. So, as a teachers, you really have to prepare yourself because being a teacher is not easy. You have to be prepared and sa tanan possible na mahitabo. Next is allow students to tape record lectures so that they can review the discussions again if ever na makalimot sila. And next is assist students in obtaining a note taker. And the last one, have the students sit in the front of the class. This help with the students to catch their attentions, concentrations, and also minimizes the distractions. So as a future teacher and as a teacher, we really have to understand and familiarize these strategies and symptoms because it will help us or guide us on how to handle students with traumatic brain injuries. Again, these conditions can occur at any time. That is why, as a teachers, it's better to be prepared all the time and use strategies in our teaching to accommodate all of our learners. We should always remember that we are the ones who will guide and help them in their learning process despite of the situations they are in. We have to make sure that they are feel welcome, safe, and makalearn jud sila. So I guess that's the end of our discussions class. Thank you for listening.